I am student nurse Angelica Contreras from BSN1-11C Group 10. Today I'm going to demonstrate how to assess the eye. Having your vision corrected can improve the quality of day-to-day life. Also, doing this assessment can help us identify some certain eye condition such as cataract, glaucoma, and age-related macular degeneration which could lead to sight loss. To start off, we need to prepare all the necessary equipment that we're going to use. So, we need a pen light to have a better visualization, the Snellen chart. You could also use e-chart, a pen, and the comprehensive health form where we are going to write all the subjective and objective data that will be gathered, alcohol to sanitize our hand, and also working gloves if necessary. Before meeting the patient, we need to do a proper hand washing or hand hygiene to deter the spreading of microorganisms. Hello, I am Angelica Contreras, your student nurse for today.
Hi,
Can you please state your name and date of birth?
Contreras, May 5, 1966.
Okay, and how would you like me to call you?
Lynn for short.
Okay, Ma'am Lynn. Are you with someone right now?
Yes, my granddaughter. She's outside now waiting for me.
Okay. Have you already eaten?
Yes.
Okay, so now, do you know what are we going to be doing?
No.
Okay, so Ma'am Lynn, today I'm going to be assessing your eye. This will involve some standing position and sitting down, and also following some movements of my hand and the pen light and the light. Okay, so if you have any clarification or concern during the assessment, don't be shy to approach me, okay?
Okay.
Okay, so can I ask what kind of glass are you wearing right now?
I'm wearing reading only. Reading glasses.
Okay, reading glasses. So, don't be embarrassed to me, Ma'am Lynn, okay? Because we're in a private room. And all the documents that will be gathered, or all the data that will be gathered, is confidential, okay? Okay, so let's start now.
Okay.
Assessing the visual acuity. This is an eye exam that checks how well the patient see the details of the letter or symbols from a specific distance. So we're going to let the patient stand 6 meters away from the Snellen chart and ask her or him to read each line until she or he cannot decipher it. Let's just assume that she is standing 6 meters away because there are no any available space. So, Ma'am Lynn, can you remove the glasses that you're wearing?
Okay.
Okay, thank you. Now, can you cover your right eye and read each line?
E F P T O Z L P E D P E C F D E D C O Z I C Z P F C L O P C D.
Okay.
Cannot read it anymore.
Okay, thank you. Now, cover the left eye.
E F P T O Z L P E D P E C F D E D F C Z P F. I cannot read it anymore.
Okay, thank you. Now, try reading it with your both eyes.
E F P T O Z L P E D P E C F D E D F C Z P F E L C P G P Z D. Then I cannot read.
Okay, thank you. Now, I'm gonna be doing some hand gesture and tell me where the direction I'm pointing to, okay?
Okay. Down, right, up, left.
Okay, so we're gonna do another test. So, Tell me how many fingers I'm raising, okay?
Okay. 1, 5, 2, 4, 3.
Okay, thank you. Testing for visual fields. So this test measures how far the eye sees in any direction without moving and how sensitive the vision is in different parts of visual field. Now, Ma'am Lynn, just look at my eyes and tell me, okay, if you can see my moving hands. Do you understand?
Okay.
Okay.
Okay. Okay. Okay. Okay.
Okay. Visual inspection of the eyes. It is important to find anything that might be wrong with the assist which could require maintenance. Now I'm going to check your eyebrow and eyelashes first. And this will involve me touching your face. Is that okay with you?
Okay.
Okay, so I see that your eyebrow is black and it is not evenly, the hair is not evenly distributed. The hair is thicker near the bridge of the nose, and as it gets farther, it also gets lesser. Now, can you move your eyebrow up and down? Okay, so the movement is equal, and also your eyebrow is in line with each other. Now I'm gonna check your eyelashes. Can you please close your eyes? Okay, now open it. So it is curled slightly outward. Now your eyelids, can you please close your eyes again? So I can see that the skin is intact and there are no any discoloration. The lids close symmetrically and there are no any swelling in the lacrimal sac. Next is, can you please continuously blink? And when I said stop, that's the time when you're going to stop, okay? Okay, go. Now, okay, stop. Then now I'm gonna check your eyes. So they are equally aligned and symmetrical with each other. Now can you look down? Okay, then look up. Okay, thank you. Now, I'm gonna be assessing your palpebral conjunctiva. This will involve me everting your eyelid. Is that okay?
Okay.
Okay, thank you. So, I observed that your conjunctiva has inflammation. Next, I'm gonna be checking your iris and pupil. This will involve me shining a light from the side towards your eye. Okay?
Okay.
Okay, so I see that your iris and pupil are both round and they both reacted to light. And your iris is brown and your pupil is black. And also, your cornea is cloudy. Assessing direct and consensual pupillary reaction to light. This is used to assess the brainstem's function. So, we need to partially darken the room to have a better visualization. Ma'am Lynn, can you please look at any object behind my back? And then I'm gonna shine a light from the corner towards your eye, okay?
Okay.
Okay. Performing Hirschberg test. This is the quick and simple way to assess if the patient have strabismus or ocular misalignment. So now, we're gonna shine a pen light on the patient's eye at a distance of 50 cm. And we're going to observe the position of the light that reflects on the patient's cornea. I can see that the reflection appear at the same position in each pupil. Performing the cardinal fields of gaze test or the extraocular muscle test. So, this test helps to determine how well the 6 extraocular eye muscles are working along with the cranial nerve 3, 4, and 6. So now we're gonna check the patient's eye movement. If there are any involuntary movement or what we call nystagmus, or the movement is just smooth. So Ma'am Lynn, now, can you please follow the pen light as I move it, but keeping your head still, okay? Just use your eyes to follow it. Do you understand?
Yes.
Okay. So, as far as I can see, the movement is smooth. Testing for convergence. This test measures the distance from your eye to where your both eye can focus without double vision. So now, I'm gonna check your eye for convergence. Please look at the pen light. Okay, thank you. Now, Ma'am Lynn, I'm gonna summarize all the observations and information that I have gathered during the assessment. So, for your visual acuity, where you read each line in the Snellen chart, your vision in the right eye is 20/30. In the left eye, it is 20/40, and both eyes are 20/30. For visual field, where I wiggle my finger and ask you to say okay if you can see my hand, the result is normal. You can see as anyone else does in the center and around the edges of the visual field. For visual inspection of the eyes, your eyebrow is black, hair not evenly distributed but aligned with each other. It also moves equally. Your eyelashes are curled slightly outward. Your eyes are equally aligned and symmetrical. Your eyelids, the skin of your eyelids are intact. I don't see any discoloration. The lids close symmetrically. And I don't see any swelling in the lacrimal sacs. In your sclera, you have bloodshot eyes, or you have some red nerves shown upon in your sclera. In iris, it is round and brown, and your pupil is round and black, but both reacted to light. And lastly, your cornea is cloudy. Next is when assessing direct and consensual pupillary reaction to light, both pupil constricts to light. Next is when we assess the accommodation. Also, both pupils constrict and equally move to cross. When we perform the Hirschberg test, reflection appear in the same position in each pupil. And also when performing the extraocular muscle test, eyes has smooth movement as they track the pen light. And lastly, when testing for convergence, the near point of your convergence is 6 cm, which is normal. Now, do you have any clarification or question? Do you understand everything?
Yes.
Okay. So, this I will give this to your attending physician. And let's just wait for the doctor's order, okay?
Okay.
Okay, so I hope you take care of your health and thank you for your participation and cooperation during the assessment.
You're welcome.
Okay, so always remember that after doing the assessment, we need to do a hand washing or hand hygiene.